Hello, this is the second installment of newborn care, and this is the third page of your document. And this specifically talks about newborn nutrition and feeding. And the way I've done this, I mind mapped the trajectory in which breastfeeding occurs. So the way I want to orient you to this page is up here, you kind of want to put a big old circle up here. This is the mom's head. Can you draw it in if you want? Remember, have the hard copy in front of you to take notes. And if you draw her head on your page, she is basically, for instance, looking to our left. So this is her profile because this is her anterior pituitary. I'm just trying to get you oriented. And on the right hand side, this is her posterior pituitary of her brain. So this is the mom's brain. This is the mom. This is her breast. This is the infant. And the very bottom is her uterus. So you can kind of see it's anatomically correct on the page, for lack of a better reason here. So let's see what happens during the course of breastfeeding, and then you're going to learn the anatomy of breastfeeding. So it's numbered here, so let's go by the numbers. The first step, here's number 1. You see where I'm at? You kind of get the gist of what's going on now. This is number 1. First, the infant begins to suckle, and he roots, he sucks, swallows, extrusion reflexes we learned in newborn assessment. He has what we call the readiness cues. Maybe he cries, he whimpers. Remember, we talked about demand feeding schedule. We tell moms she needs to feed him when he's hungry. It's not a strict schedule, it's when the baby demands it. Positioning is very important on her breast. We talk about nipple confusion because we tell the moms not to bottle feed the baby nor use a pacifier while she's breastfeeding because he can prefer the nipple over her breast and may stop breastfeeding. And we talk about back to sleep, how we tell her she needs to put the baby back on his back supine to sleep to avoid SIDS. So that's number 1. Let's go to number 2. Once he suckles, then the anterior pituitary begins to produce prolactin. Just think pro is for lactin is lactation. It's a hormone that starts the prolactin reflex. And where's number 3? After prolactin starts, the breast here, step 3, begins to produce milk. It's produced in the alveolar cells of the mammary gland, and it begins to start producing in there, anatomically speaking. Number 4, the baby continues to suckle. And then what occurs, step 5, is the posterior pituitary begins to produce the hormone oxytocin. Oxytocin is called, if you heard of it, the love hormone. It produces the letdown reflex. It's also called the milk ejection reflex. Moms will say that when they feel the hormone affecting their breast, they feel a tingling, pulling, or squeezing motion. Let's go to number 6, and then what happens in step 6, nipple erection occurs, the propulsion of milk goes to the lactiferous sinuses, and then nipple pores. Human milk, the first milk is called colostrum. It's the first milk the mom produces within the first few days of life. If the mom does not want to breastfeed, you want to encourage her at least get her baby to drink the colostrum. It's very high in protein. It's very high in immunoglobulin A, which is the antibody that really helps the baby in his immunity. And it is what we call passive immunity because it's passed from mom to baby. And it looks yellow. Then the mature milk comes, which is more higher in fat and looks more white. It's amazing that the human milk contains many antibacterial, antiviral properties, growth factors, digestive enzymes, and protein. They did a research study in which they found that people who were raised on breast milk versus formula had less incidence of cardiovascular disease, diabetes, asthma, allergies, you name it. They know that breastfeeding is what's best for baby. We are going to teach moms how to pump and to store her milk. We're finding all the stuff that you knew from the protocols. Drugs, she'll ask about what types of drugs can she take during breastfeeding. We tell her to look up the American Academy of Pediatrics ratings 1 through 7. You've seen it in your drug book in terms of whether that milk will pass through mom to baby and whether it is dangerous or not. So you'll see that. We teach mom about taking care of herself if she's engorged. We tell her to use ice. If the baby's jaundice, what to do, sore nipples, venereal infections, if she has plugged milk ducts, and if she has what we call it's infection of her breast, it's called mastitis. It should never be red, swollen, and painful, which is obviously not normal. She needs to see the doctor for antibiotics for that. So that's number 6. And then lastly, the last portion is number 7. When mom breastfeeds, the oxytocin produces uterine, what we call constriction or contraction, and it's called involution. And we learned that in postpartum assessment. And at cramp, she begins to cramp and she produces blood, which is called lochia. So the commonality which you hear from moms, they'll say, yes, when I start breastfeeding, I feel a cramping. Is that good? And you say, of course, that is good. You may not think so, but it's to what? It's to prevent postpartum hemorrhage. So she may say, also, after I breastfeed or while I'm breastfeeding, I feel a gush of blood down there. Is that normal? And we say that is normal. So what you want to remind moms are that breastfeeding is wonderful for the baby, and it's obviously Mother Nature's way of preventing postpartum hemorrhage. And that's it on this page.